Hi, Paula. Dr. Arculeo, very nice to meet you. Thanks for coming in. I understand you saw us on Facebook or Instagram, right? Okay, excellent. What specifically did you see that attracted you, that made you want to take it one step further and come in?
The procedure that they was taking to.
Mm-hmm. What'd you like about that, the procedure?
It looked like it was painless.
Mm. It is. It is. Powerful and effective, but painless. Mm-hmm. So I'm with you on that. Now, I read over your form here, and I have some important prepared questions for you. Before I get into that, I just have a couple questions for you. Have you had any experience with physical therapy or chiropractic in the past? No. No. Okay. Have you heard anything? Have you been exposed? Any friends or family gone to see physical therapists or chiropractors?
I mean, my sister's husband, he did, but he did. He went to see somebody. They was giving him cortisone shots.
Oh, cortisone shots. Okay, got it. All right. Now, I wanted to ask you. You checked off neck pain and back pain. It looks like the low back pain is a bigger concern of yours. Is that the main concern?
Yes.
Got it. Thank you. And it's been going on 2 years now, and it's causing every day. It's bothering you. Mm-hmm. And it's an 8 out of 10 in pain intensity.
Yes.
Wow, that's not good. I'm sorry to hear that. Describe what it's like when it's at its worst.
When it's at its worst, it hit me one time where I couldn't even make it to the bathroom. It was just, I couldn't walk. But that part only happened one time to me, maybe twice.
Okay, I understand.
And laid on a heating pad.
How does it feel day to day, like today and yesterday? What's it feeling like now?
Today is so. I don't know if this thing with the rain thing really does work, but for some reason, when it rains, it just
makes it worse.
Aggravates it. It makes it worse.
Rain aggravates. Can you point to the area where you're feeling it the most?
Oh, yeah.
You're moving carefully, I notice. Right through there. Okay, I'm touching that right there. I got it. Okay, you can sit down. Thank you. More on the right side, I'm taking it,
yeah.
Huh? Okay. I'm sorry to hear that. Now, I'm going to jump around, but then we're going to talk about the back. You also complain of having some neck pain. How long has that been going on for?
That's just been going on for a couple of months. And I don't know if it's, I might need a massage. I don't know.
Yeah. Do you have it every day?
So. It's not as bad as my back, though.
I got it. What's the pain intensity on that?
That's probably like a 5.
Thank you. Now, you've tried, I saw that you checked off here that you've tried some medications. What have you tried for the back?
Advil, Adleve, ibuprofen.
Wow. You've tried a lot. Have you tried any other treatments or methods?
No.
Okay, got it.
But the only thing with taking those, I can't take 2. They're not strong enough. I would have to take 3.
Wow. 4. It's safe to say that these things that you've done, these pills you've taken, have only provided you even temporary relief at best?
Right.
So even if you tried it, it's only been temporary. Mm-hmm. Has that been frustrating at all, that it's not going away and these treatments are only temporary?
Yeah.
Discouraging or frustrating at all?
Yeah, it's frustrating.
I hear you.
I'm 52. I don't think I should have to walk around smelling like Ben Gay all the
time. I agree. I'm 52 too, so I agree with you. Ben Gay. Where'd they come up with that name of that drug? Isn't that a weird name?
Yes.
It was obviously before that term was used more popularly, right? Okay, just practically, I want to ask you, practically speaking, how is this negatively affecting you?
mean, it's really not really bad with, you know, I'm depressed or nothing like that, but it's...
You are depressed or not depressed?
No, I'm not depressed.
Good.
No, I'm not depressed.
Okay.
No.
But how's it negatively impacting your life, negatively affecting you?
It's really not, because it's not stopping me from doing anything really, but it's just, when they flare up, that's my only concern. It doesn't really stop me from doing anything. I still work.
What do you do, work-wise?
I work at a warehouse.
All right. Is that physical?
Yes.
Okay. Are you concerned this might interfere with some of your physical duties?
I think it might.
If it gets worse.
Because I do, 10-hour shifts. Sometimes I'm lifting and picking and bending. So, yeah. I have to go to work prepared. My lunch bag, my medicine bag, my pain pills, my heat wrap.
That's horrible. That's like an old lady. You're not an old lady yet. You shouldn't be carrying around your pills like an old lady. All right. Now, listen, I'm not crazy about those drugs, I'll tell you right now, because their drugs aren't fixing anything. They're just covering it up. Mm-hmm. And if you ignore a problem, what typically happens to it?
Get worse.
You know it. You've been around long enough to know that. So let me ask you this, more of on a positive note. Is there anything you'd do more of or just enjoy more if you didn't have this going on?
No. I still do the same thing.
I got it.
I still
I hear you. Now, pardon me, you may have already said this, but tell me, what's the most important reason why you want to get this taken care of?
I'm tired of having to wake up and go to sleep taking pills. Because I don't want it to get somewhere I have to take more of just an over-the-counter pill than if I have to get something stronger. I'm not trying to get addictive to nothing.
You know that's a problem these days, right?
Yes.
There's opioids. You've heard of this opioids, the strong drug addictions? Worse than heroin or cocaine in the numbers.
And I ain't trying to do that. So if I could find a way to help me out without having to take Oxycontin and, all this type of stuff, I'd rather do that. Even if I looked into trying to find out how do you do the cortisone shot, even if that would help me.
That's only temporary, and there's a lot of side effects. Cortisone could aggravate diabetes, it cause osteoporosis, thinning of the bones, cause cataracts. Okay. Lowers the immune system, and has also been linked with excessive weight gain. Okay. So cortisone, it's such a big deal with the side effects. Medicare has just outlawed the excessive use of it. They've really limited the allowable amount now. So that's not a great option. Plus, we got to find out what's causing it, not just throw something at you to cover it up. You've already done that for long enough. How long has this been going on for? 2 years? Oh my gosh, that's too long. Now, this has been going on for 2 years. I got an important question I got to ask you here. What do you think it'll be like in a year or two if you ignore this and don't do anything about it?
It's going to be worse then.
Got it. I probably agree with you. And then if it did get worse, how would that affect you?
I'll be looking for some Oxycontin and some of that stuff. They take the pain away.
Right. Which you already told me you don't like the idea. So is it safe to say you got to do something different than what you're doing now? Because you've been doing the same thing. You're not getting any results, right? So now this is an important question, and this one may even determine if I could help you or not. Mentally, where are you in wanting to take care of this and finally get rid of this once and for all? 1, you're not going to do a thing, just let it get worse. 10, you're going to do what it takes.
Yeah. I'm at 10.
You're at 10. Okay, I'm at 10 too. Now, listen, Paula, many of our patients, the vast majority of them, in fact, have gotten falls, strains, injuries, stress that add up to knock the spine out of alignment, to pinch nerves, to slip discs that add up to all this that could be causing the symptoms you very well have. So it's not always obvious, like it happened yesterday and you have pain the next day. Sometimes it's years before, kind of like decay on teeth. You don't say, oh, it was the Snicker bar I had yesterday. It took years to perhaps get the decay to cause the tooth decay, right?
Right.
So I want to survey some possible ways this could have originated over the years. So when's your most recent car accident?
No.
Never had one even as a passenger?
No.
Okay, very good. How about a bicycle injury, motorcycle?
No.
Okay, thank you. Sports, exercise, anytime, even go dating back when you were quite a bit younger?
No.
Good. Any slips or falls around the city, on the ground?
No.
Don't be holding out on me here. Okay, girl. How about on the ice in Chicago here? You live in Chicago, right?
Yeah.
Any slips on the ice?
I might have fell down some stairs before.
Tell me about that. That might be important.
It was...
How many years ago?
6 years ago.
Okay.
And I was coming out for work. There was black ice on the stairs.
Black ice.
I fell down the stairs and I got up and...
Did you fall on your bottom or your back?
I fell on my butt.
I'm putting a star next to this one because that could be important. We're going to see.
Okay.
Any other falls like that that's important even when you're younger?
No.
Okay. How about work injuries? You work,
I work, but I never had an injury.
in lifting things or moving things?
I have done a lot of warehouse work over the years, but I've never hurt myself.
Let's just put a year on that. How many years of warehouse work?
Oh, let's say 4.
That's a lot. It could add up. Who knows? I don't know. We're going to have to look this over. Let me tell you how things work here. I'm glad you came in. We're going to be able to get a lot done today. I'm glad you're here in the SpineTech offer. I will tell you this, though. We don't accept every case because to qualify to be a patient here, 2 things have to happen. We have to know we could help you, and we also have to know you're going to be a good patient. So if we get great results because of that, because we don't just take people on. Because we'll be honest with you. If we could help you, we'll let you know. If we can't help you, we're not going to waste your time.
Right.
So I ask you these questions to weed out people that aren't ready to really take care of it, but it sounds like you're kind of fed up. So if we find we could help you, and we could help you without more drugs or surgery, is this something you want to really dig into and take care of?
Yes.
Good. So what would be an optimal situation for you in 6 months?
Optimal.
Yeah, like where would you like to be 6 months? You look back and say, oh, now I'm really happy with my health.
That's why I want to be in 6 months.
Like what? You tell me.
Happy with my health.
Happy with your health? Okay. You stole my words. That's okay, though. Okay, what would make you, this is more I want to know how you'd be treated, because everybody has a different viewpoint on that. What would make you feel good about your experience here?
Being cured.
Okay.
That would make me really happy.
Amen. That's what we're all about. You saw all the pictures on the hallway there, right? That I want you up there possibly. All right, excellent. Now, we've helped many cases, as you can look in the hallway. You don't have to listen to me. We've helped cases much worse than yours, but I'll be honest with you. I can't promise you anything without looking at you. And you came in for the offer, and the offer is great. It's ridiculously good. It normally costs $225. You're getting it for $19. What it's going to consist of is I want to run a special scan on you. And this SpineTech scan that you may have seen on the ad is more sensitive than an MRI. And it's going to look at 4 different factors of where your spine, your back could be bad. And we want to determine, first of all, I know it's not just the muscle. If it was muscle, it would have went away in a couple weeks. Okay. Muscle problems don't last that long. Your body's not healing on its own. Normally you cut yourself, you heal. You're not healing on your own. So it's got to either be a pinched nerve or a slip disc or both. Okay? We're going to set out to determine that today, and the spinal scan will do one part of it. We need to do some x-rays. Now, that's not normally included in the $19, but I'm not going to stick you with that. I'm going to throw that in for free, but I don't want to guess. I want to see what's going on. I want to see that internal architecture to see if there's a slip disc. Because it might be what you're talking about lasting 2 years and seizing up occasionally. I'm worried it might be involved in that. But if we catch it early, we're good with that. So let's do the scan. Let's do the x-rays. Let's take a good hard look at you. Then we're going to be done for today. And then I'm going to have you come back because you get a treatment that comes with all this $90 package. You're going to come back. We're going to go over the results. And I'm going to let you know if we could help you or not. Now, between those 2 visits, after you leave here today, we're going to meet as a team. Okay. We're going to be talking about you behind your back. We're going to be going over your x-rays, your scan, your information that you communicated very well, thank you. And we're going to decide if we're going to take you on. We have a medical doctor on staff. We have 3 chiropractors, all of which are trained on the SpineTech. And we have a physical therapy staff as well. So we're a team approach to help problems like yours. Okay. So you're going to get a first, second, and third opinion straight away. When you come back, I'll let you know what we determined, and we're only going to take you on if we can help you out. If we can't help you, I'm not going to waste your time or money or efforts, and we'll take it from there. Okay, did you get the girls up front, your insurance information?
I don't have insurance, so everything I was doing would be...
Okay. Well, I'll just let you know up front, we have special programs with people, special discounted rates, because we're able to pass on to you savings because we don't have to fight with the insurance companies or do half the paperwork. Okay. So we have a lot of people like you. We got to take good care of you because the typical medical approach has not worked for you. Okay. And 2 years, you've been so patient. I don't know how you lasted so long. You're a more patient lady than I am. You know what I'm talking about? Okay. Okay, darling, let me just mark a couple things. Now, I drilled you for a lot of questions. Do you have any questions for me?
No.
Okay, is there anything else I should know about your health? Any other health conditions I should know about?
Other than I have high blood pressure, that's it.
Okay, we have a lot of patients with high blood pressure. Everything we do here is natural and safe, so you would be in good hands here. Okay, darling, let's head up front. Let's do the scan straight away. Up front to do the